Thank you, Dr. Taylor, for those kinder words than are necessary. Thank you. President Taylor, members of the board, faculty, parents, and especially you, class of 2022, I'm honored and humbled as a proud Gannon alumnus to be speaking with you today. During my years at Gannon, I had the opportunity to learn so many things both inside and outside the classroom. The courses I took helped me earn my undergraduate degree in chemistry and prepared me to move on to medical school at Penn State College of Medicine. But one of the greatest lessons I learned outside the classroom was to be real. Be your authentic self and display that to the world. So that's what you're getting from me today, and it's about to get real. First and foremost, congratulations on your amazing achievement. You did it. You graduate today. Take time to celebrate and revel in what you've accomplished, but I remind you and everyone here today that the word commencement means beginning or start. Today starts your journey as working people fully trained to be independent practitioners in your chosen fields. That's really amazing, and I'm so excited and thrilled to be witness to that beginning. It's okay to be a little scared, but all you've worked for has led up to this new beginning. I've had the privilege of taking care of patients as an attending physician for 16 years now, and I've also had the privilege of teaching medical students and residents at the Warren Alpert School of Medicine at Brown over those years. Suffice it to say, I've learned valuable practical lessons that I intend to pass on today. I've sat through long and boring commencement speeches in the past and always wished that someone would have given practical advice, so with my time, I'd like to do just that. Every discipline represented today will care for patients. Remember that every professional decision that you make is intended to directly improve the life of another person. We don't always get the outcome that we want, but that's the intention. It's not like a profession such as law, where for you to win, someone else has to lose. And I suppose if you make iPhones, you're improving someone's life indirectly. But in patient care, you have a direct impact on trying to make someone's life better. It's a huge honor as well as a tremendous responsibility. There can be much negativity in healthcare, and it's easy to get swept up in that. But if you keep the care of the patient as your North Star, I promise you, you will find joy. I want you to understand one very important truth. You belong. I'd like to introduce you to a concept called the imposter syndrome. Has anybody heard of that? Yeah. It's common in healthcare, and it's when you're afraid of being exposed for the fraud that you yourself know you really are. Everyone else has it figured out, and you're just faking it till you make it. You hear someone answer a question in class, and you think, how do they know that? They're so much smarter than me. And then when you answer a question, you just assume everyone else knew that. Have you ever felt that way? Anybody? Okay. Well, it's a trick question if you said no, because I know you all have, because we all do. And I promise when you answered those questions, others were in awe of you. I wish I could tell you that the imposter syndrome goes away, but I can't. I speak with medical students and residents who come to our program from all over the world, and it's a universal problem. So while I can't say that there's a cure, what I can offer is that it gets better with time. You learn to trust yourself and your abilities, and only experience can do that. We all have to remember that excellence is the standard and the expectation in healthcare. And because of this, if you're performing at a level of excellence, often no one lets you know because it's the expectation. I hope you get the praise that you deserve at work. But if not, know that it is not a reflection of your poor performance, but an acknowledgement of your excellence. Furthermore, when you take on supervisory roles, work to recognize your colleagues' hard work. Do it often. Make it weird. In schools, you're trying your best to get good grades and do well in clinicals. It's your job to earn those things as a student. You want to impress people that are evaluating you, and in fact, you pay for those skills by way of tuition. However, as an employee, the people hiring you want and need you. They value the knowledge you've gained and what you have to offer. They're even going to pay you. So remember, employment is a two-way street. They need you as much, if not more, than you need your employer. No one's going to spend time and effort and resources to onboard you just to find out your mistakes and to fire you. They want you, and you belong. Don't be cocky, but as a new hire, you know the most up-to-date information and practices in your field. Be humble, but know you deserve to be where you are today and where your future will take you. Next, you can't take care of other people if you don't take care of yourself. This is a non-negotiable on my teams in the hospital. I hear people say all the time that they worked all day and didn't have time to use the restroom. We work in a field where there's always one more thing to do. Sign that note, write that order, check in on Mrs. Smith. I'll just take care of that and then I'll go to the bathroom. Cut out that logic. There will always be another thing to do, and all of those things will be there when you get back. The same thing goes for eating. We're expected to be pleasant in the face of human suffering. You can't do that if you're hangry. You'll chart better, provide better care, make less mistakes if you give the brain your glucose it needs to do its job. And this goes beyond the workplace. Make it a habit to exercise, do meditation, fill yourself up with the things that give you joy. Your profession is only a part of who you are as a person. Cultivate and grow your passions. Make time to learn new and exciting things. Currently, burnout is a hot topic in medicine and really in the workforce in general, and is an occupational hazard. Tate Shannonfelt from Stanford, who's a world expert in burnout, shows pictures at the beginning of each of his talks of a boxer being punched in the face. Dr. Shannonfelt points out that that boxer doesn't need to be more mindful of his situation. The boxer knows what's happening. And the boxer doesn't need to be more present. There's a keen sense of awareness of what's happening to him at that point. The problem is that there's a hazard in the workplace. While we're starting to see that employers have an important role to fight against employee burnout, taking care of yourself will give you the armor to protect yourself against those harms. Also, respect everyone. But on the flip side, don't accept being yelled at. I hear different disciplines and other subspecialties make remarks about each other often. Why did the emergency room admit that patient? Why does the ortho team need a medicine consult for simple diabetic management? Aren't they doctors too? Why do those stupid doctors reflexively put in PT and OT orders? Can't they see there's a difference and the patient only needs OT? Anybody heard that in clinicals? Thought so. What I suggest to you is think about things a little bit differently. You do something that not everyone else does, and they do things that you don't. By respecting that, and by respecting each other, it makes for a more collegial work environment, which is better for you and your patients. I was recently in County Kerry, Ireland, philosophizing in a pub with the locals, as one is wont to do in a pub in Ireland. And a gentleman said to me that the unofficial motto in Ireland is, "It's nice to be nice." That struck me as so simple yet so profound. If everyone was nice, the world would be a better place. But also that being nice doesn't need to be transactional. You don't need to get anything in return because it's just nice to be nice. One can gather personal satisfaction just in the act of being nice. So I challenge you all to do that. Be nice. Make it your motto. Be the first to say hi. If someone is lost, take them where they need to go. Help out whenever you can. Now, that being said, it is never appropriate to be yelled at work. Ever. Please take this right now as permission to calmly say to anyone yelling at you, we all have the same aim, and it's to take care of the patient, so please don't yell at me. I'm trying to help. If that doesn't work, tell your supervisor. Don't accept the phrase, oh, that's Dr. So-and-so being the way they always are. Bad behavior shouldn't be tolerated in healthcare, at all. And if you don't feel comfortable going to your supervisor, email me at bcollins@lifespan.org, and I'll figure it out and call and say something. That's how serious I am about that. Do not accept being yelled at. While your family and friends deserve tremendous thank you for helping you get where you are, and I try to thank mine often, there are loads of people who have mentored you along the way. Be intentional about what they did to make an impact on your life and incorporate that into your practice. Quote them often and give them credit. Shout them out whenever they get an opportunity because they deserve it. You're standing on their shoulders. And taking my own advice, if you'll indulge me, I'd like to thank some of those people that got me here today, and I promise to run through them quickly. My hometown mentors, Dr. David McCandless, Dr. Jim McLaughlin, Dr. John Chonard. From high school, Father John Schultz, Father John Weibel, Father Bill O'Brien, and Coach Andy Rapp. At Gannon, Dr. Stephen Melanie Robsky, Mr. Dave Fabian, Dr. Buchholz, Dr. Pelzar, Father Drexler, Father Rao, Father Strohmeyer, Father Dedish, Father Gregoric, Father Kasicki. Can you tell I went to Catholic school all through my life? At Penn State, Dr. Herb Reynolds, Dr. Dennis Gingrich, Dr. Phil Masters, Dr. Rachel Levine, the Deputy Director of Health and Human Services. And at Brown, Dr. Fred Schiffman, Dr. Dom Tomorrow, Dr. Kelly McGarry, Dr. Mark Fagan, Dr. Kwame DePaw, and the Rhode Island Governor, Dan McKee. And a special thanks to them, as well as to my wife, Tiffany, my parents, Dean and Cindy Collins, and my sibling, Abby, a Gannon grad as well, Graham and Hillary, and my children, Wanda, Joseph, Lucy, William, Elsie, and Jack. Likewise, be a mentor to share your knowledge. You never know what an impact you can have on someone else's life. Along with recognizing your mentors, you have an obligation to remember the school that made you who you are. You are a graduate of Gannon University. We aren't the biggest nor the most prestigious university in the US, but we do have an amazing amount of alumni doing great things across the country. Many are proud of where they came from and are willing to help alumni in any way that they can. If you've ever watched and enjoyed This Is Us, New Amsterdam, Brooklyn Nine-Nine, Superstore, or The Good Place, you can thank Gannon graduate Mike Nunes, who is a senior VP for NBC Universal. The 2022 winner of the American Institute of Aeronautics and Astronautics Engineer of the Year is rocket scientist and Gannon graduate Paul Gradle. National correspondent for the Washington Post is Gannon grad Tim Craig. And all those people were just people at Gannon while I was there. It goes on, and you are a part of that legacy today. So how do you tap into all of that information, networking, and communication? By joining the Gannon University Alumni Association. It's a way to stay connected and find out how Gannon can help you, and also how you can help the university. Here's a thought. While you're waiting to have your name called up to get your diploma, you can go onto Facebook and like and follow the Alumni Association page. It's easy to do. The staff is excellent and does a great job keeping alumni engaged and active. Also consider being generous in the way of giving back to the university. You don't need to give thousands of dollars or enough to get a new building named after you, though if you can, please do that. But set it up like an autopay subscription service. Start with $5 a month, less than Netflix or Spotify. Put it on recurring withdrawal. By the end of the year, you gave $60. Go you, that's awesome. That $60 you can use as a tax write-off. Then reevaluate, can you do more? Do you need to do less? But know that every dollar goes to helping make the dream of a Gannon education available to someone else. If you benefited from a scholarship during your time at Gannon, know that that came from a donor and most likely an alumni donor. Consider doing the same for someone else. No pressure. This isn't a sales pitch and we're not going to pass a hat. Just asking you to think about it. So in conclusion, remember, keep your patience as your North Star. You belong. Be nice. Don't allow anyone to yell at you. Take care of yourself. Recognize your mentors. Join the Alumni Association. Be involved and give if you can. My parting wish for you is that your Gannon experience does for you all the great things that it's done for me. I have little doubt that it will. Best of luck. The entire Gannon family is rooting for you. Thank you.